Okay, so I'm just off on the night shift and Sonia's finished the day shift. What's this?
So this is from one of my old school friends I haven't seen in, well, since school really, who got in touch yesterday and says, to Sonia and the medics lodging with you, a very small gesture to say a huge thank you for the incredible work you are all doing to combat this horrible virus. If one good thing is to come out of this, it will be that no one will take our wonderful doctors and nurses for granted. So big up, Lara.
Oh, thank you so much.
We shall enjoy that.
Look
but
at
I
that.
won't let
Can I have a bottle now?
No, not until you're back from work, mate. Later on.
So we're at the hospital, ready to get going. That message that Sonia got sent, I've had so many similar things from loads of my friends and family as well, and I'm sure all the doctors and nurses and everyone that works in the NHS is getting similar things. It keeps you motivated. I've even had messages off ex-girlfriends that I thought absolutely hated me. Also, that's not the only win today. I've got another parking space, but not only that, the hospital sent a message around to say they're not going to give any staff any parking tickets for parking in the wrong areas over the next 3 months. Wait, so if it's all those small battles you've got to be thankful for. So I'm going to get changed into my scrubs. Yesterday when I left work, there were no scrubs in my size, and that's because all the healthcare workers, so the nurses and radiographers and healthcare assistants, normally have different uniforms, but we're all in scrubs. So it's kind of like we're all, this blue army transcending onto the ward. Look at how baggy these scrubs are. It's like I'm a doctor in the 70s. Good evening, or should I say morning. The time is 3:23. Pretty much halfway through this night shift. The mask thing is still an issue, but we'll leave that for another day. Seeing loads of patients with COVID-19, giving all the classic symptoms, but presenting in different severities. Many of the patients I've seen have been able to go home. Very important to give very good safety net advice, so what to look out for to come back into hospital. So things like increasing shortness of breath, chest pain, any drowsiness or anything else that's worrying them. The difficulty is you can't name every single thing they should come back for, so you have to give them an idea and instill confidence that they know their body, and if they're unsure then medical advice is always available. It's a critical time in the logistical management here, because the hospital have done such a good job to clear the wards and have space for extra medical patients. And I know the medical team, so the team on the wards, are doing a fantastic job looking after the patients that need oxygen and that supportive therapy, and are getting reviewed by the intensive care unit if people need things like ventilation. So being the first people they see, I feel like my job is to identify those 3 areas that people are likely to be. So do they need intensive care to be reviewed within A&E? I haven't seen any patients that have needed that myself, but we certainly have had them. So people are coming and are really struggling from the disease. So most of the time if people do need some supplementary oxygen, I'll be referring them to the medical team. And so far there are beds available. However, the issue is things might fill up very quickly. So I really feel like it's my job to make sure that we protect the beds for the people that really need it, and people that can recover at home. As we said, 80% of people with the virus will recover well at home, are the ones that we are reassuring, sending them home, but giving them good safety net advice. I feel like as an emergency doctor, that's really what we're going to be doing. That will make a big difference to this situation, making sure we're using all the resources wisely. We all have heard the statistics that it tends to affect elderly people and more vulnerable people more, but we are seeing younger people with the condition, so people in their 30s and 40s. I know it's more likely to affect people in a more adverse way in the elderly population, the vulnerable population. But inevitably in hospital, we are going to see all the people that develop complications, and we are seeing young people, and that, well, I mean, you don't like seeing anyone with the illness, but that's something that I feel like we're getting blasé a little bit about in our coverage of it. And finally, just some big things that happen in terms of logistics. So at the moment in our department, we have one corridor that is just for the COVID-19 patients, the high-risk patients, and the rest of the department has been for people who have things other than COVID-19. And that gives you an idea that we're generally seeing more people without it at the moment. However, tomorrow, the whole department's getting cleaned and we're actually kind of switching around. So we're going to have one corridor that is for people without COVID-19 and the rest of the department is for everyone with it. So that just gives you an idea of how much we're having to scale this up. Also, no visitors anymore. So anyone coming into hospital in the emergency department, you're not allowed to have a visitor in your room. Also having stricter rules on what we wear, so everyone's in scrubs, as I said when I came onto the shift, and where we get changed as well, so there's not kind of cross-contamination as we're walking through departments. And the whole flow of staff and patients, the two areas of the emergency department where the COVID patients are and everyone else is going to be completely separate, so no one should be walking through. It's having a big impact, and rightly so, because it's such a contagious illness. There you are, a little update on what's happening in the emergency department. I'm feeling good, got a few hours left. I'm going to recharge my batteries, have a bit of a snack, and then crack on with it. And I'll speak to you guys in the morning. Sausage roll. This vending machine is so over the top, so over-engineered. Pepsi Max. Another night shift done, and I'm gonna debrief this one back at the house because we definitely have some things to talk about. If you're watching this and you're like me, healthy, you are so lucky right now. What some of the patients on the ward are going through, and some of my colleagues going through looking after them, it is a horrific scene. I caught up with some of the medical doctors, the ones working on the wards. Now, I've talked to you about the patients I've seen, and generally speaking, the patients that I see will go one of two ways. They'll improve on the ward and be discharged, or they'll deteriorate. Many of them will die. So imagine being on that ward where people are dying every single day, which is, death happens on a medical ward, but not to the amount that we're seeing at the moment. People aren't allowed any visitors. And these are wards specifically for people with COVID. So imagine seeing people coming in and people dying on the same ward as you in those kind of numbers. It's like, it does feel like a war zone in terms of troops coming back from the front line. I feel very lucky being in the emergency department because I'll either refer them to the medical team for the ward care or to the intensive care unit if they need ventilatory support, or I'll send them home. I won't see the reality of people struggling to breathe for days and people dying, you know, alone without people, their family around. Now, there are exceptions. We do allow people to visit relatives if we think it's end of life. But very often when a patient's like that, they won't know a lot. That will be tough for someone to have that in their last few moments. What's scary to think is that the patients I'm seeing that come in, we're just starting this, and every patient I see come in, the number of people they could have infected, 2, 3, 4, 5, who knows? That's the magnitude of people that are going to start coming in from the cases we've seen. That is a scary thought. So if you're watching this, you should feel very lucky. We can often feel like our world's turned upside down because of isolation and having money woes, and you're entitled to be down about that, but just remember what you're doing it for.